terminal. The cyclic AMP activates protein kinase, causing phosphorylation of a protein, which itself is part of potassium channels in sensory synaptic terminal membrane, and is going to block the potassium conductance. The blockage can last for minutes up to several weeks even. Now, the lack of potassium conductance causes greatly prolonged action potential in the synaptic terminal because the flow of potassium ions out of terminal is necessary for rapid recovery from the action potential. Now, the prolonged action potential causes prolonged activation of calcium channels and is allowing tremendous quantities of calcium ions to enter the sensory synaptic terminal. These calcium ions causes greatly increased transmitter release by the synapse, thereby markedly facilitating synaptic transmission to the subsequent neuron. Long-term memory. There is no obvious demarcation between the more prolonged types of intermediate long-term memory and true long-term memory. Long-term memory is generally believed to be resulting from actual structural changes instead of only chemical changes at the synapses, and these enhance or suppress the signal conduction. Structural changes leading to long-term memory, the most important of them are that there is increase in vesicle release sites for secretion of transmitter substance. There is increase in number of transmitter vesicles. There is increase in number of presynaptic terminal. There is changes in the structures of the dendritic spines which permit transmission of stronger signals. Soon after birth, there is a principle of use it or lose it that governs the final number of neurons and their connectivities in respective parts of the human nervous system. This is actually a type of learning. For example, if one eye of a newborn animal is covered for many weeks after birth, neurons in the alternate stripes of cerebral visual cortex neurons normally connected to covered eye will degenerate, and the covered eye will remain either partially or totally blind for the remainder of the life. For short-term memory to be converted into long-term memory that can be recalled weeks or years later, it must become consolidated. The short-term memory, if activated repeatedly, will initiate chemical, physical, and anatomical changes in the synapses, which are responsible for the long-term type of memory. This process requires 5 to 10 minutes for minimal consolidation and 1 hour or more for strong consolidation. For instance, if a strong sensory impression is made on the brain but is then followed within a minute or so by an electrically induced brain conversion, the sensory experience will not be remembered. Likewise, brain concussion, sudden application of deep general anesthesia, or any other effect that temporarily blocks the dynamic function of the brain can prevent consolidation. Consolidation phenomena of rehearsal of short-term memory is that rehearsal enhances the transference of short-term memory into long-term memory. Rehearsal of the same information again and again in the mind accelerates and potentiates the degree of transfer of short-term memory into long-term memory and therefore accelerates and enhances consolidation. This explains why a person can remember a small amount of information studied in depth far better than large amount of information studied only superficially. It also explains why a person who is wide awake can consolidate memories far better than a person who is in a state of mental fatigue. One of the most important features of consolidation is that new memories are codified into different classes of information. During this process, similar types of information are pulled from the memory storage bins and used to help process the new information. The new and old are compared for similarities and differences rather than to store the new information unprocessed. Thus, during consolidation, the new memories are not stored randomly in the brain but are stored in direct association with other memories of the same type. This is necessary if one is able to search the memory store at a later date to find the required information. Now, there is presence of role of specific parts of the brain in the memory process. Hippocampus promotes the storage of memories. Anterograde amnesia after hippocampal lesions. The hippocampus is the most medial portion of the temporal lobe cortex, where it falls first medially underneath the brain and then upward into the lower inside surface of lateral ventricle. The two hippocampi, they have been removed for treatment of epilepsy in a few patients, and this procedure does not seriously affect the person's memory for information stored in the brain before the removal of hippocampi. You can see. After removal, these people, they have virtually no capability for storing verbal and symbolic types of memories, that is, the declarative types of memory, in long-term memory or even in intermediate memory lasting longer than a few minutes. Therefore, these people are unable to establish new long-term memories of these types of information that are the basis of intelligence, and this is called anterograde amnesia. The hippocampi, they are among the most important output pathways from the reward and punishment areas of the limbic system. Sensory stimuli or thoughts that cause pain excite the limbic punishment centers. Stimuli that cause pleasure, happiness, or sense of reward excite the limbic reward centers. Now, what is retrograde amnesia? That is, the inability to recall the memories from the past. When retrograde amnesia occurs, the degree of amnesia for recent events is likely to be much greater than for events of the distant past. The reason for this difference is probably that the distant memories have been rehearsed so many times that the memory traces are deeply ingrained and elements of these memories are stored in widespread areas of the brain. In some people who have hippocampal lesions, some degree of retrograde amnesia occurs along the anterograde amnesia, which suggests that these two types of amnesia are at least partially related and that hippocampal lesions can cause both. Damage in some thalamic areas may lead specifically to retrograde amnesia without causing significant anterograde amnesia. Hippocampi, they are not important in reflexive learning. People with hippocampal lesions usually do not have difficulty in learning physical skills which do not involve verbalization or symbolic types of intelligence. For instance, these people can still learn the rapid hand and physical skills required in many types of sports. This type of learning is called skill learning or reflexive learning. It depends on physically repeating the required tasks over and over again, rather than on symbolical rehearsing in the mind. So this is all about the memory, the dominant hemispheres. So stay blessed. Allah Hafiz.